just quick, I think we've had a recent sort of episode in the news in Connecticut, that sort of emphasizes, you talk about when you should start talking to kids. A 13-year-old kid who died of what they think may have been a suspected fentanyl overdose. 7th grade, 13 years old. And I guess just one other point in terms of talking to kids is when we're talking about addiction, it's sort of a multifaceted, the things that play into that, psychosocial environment, genetics. I have a family where sort of the drug of choice was alcohol. My grandfather died of liver disease at a relatively young age. And there's a genetic component to this. And it's important that if our kids are at risk, they be aware of that and what some of the strategies may be to protect themselves. And one of the things that they can do is delaying trying these medications. When you look at alcohol, there have been some studies that say that if you start drinking before age 15, your risk of having problem drinking later in life is like 4-fold that if you kind of hold off, just, take some time and wait. And that's something that I've shared with my 2 kids. Hey, I know you're going to experiment, but what I'm asking you is, your brains are still, like, the circuitry is in process of being wired. Don't mess with that. Hold off as long as you can.
That is almost exactly what I said to my kids. Like, I know you're going to experiment. I never want you to do heroin and I never want you to do injectables, but I have to say that the fentanyl that is in our community is so scary because I feel like we're seeing so much of it. It's just, more potent than heroin. And we're seeing a lot of, Jay, I don't know if you're seeing how many overdoses you're getting, but like in peds, we see kids who are really, really affected, a couple kids who've needed CPR and have come back with Narcan. But I think that a lot of it is just the fentanyl and they don't know what they're getting. They think they're getting one thing, they're getting something completely different.
Well, we have weekly overdoses that we deal with here at the Westernfield Police Department, and the fire department obviously deals with it as well. Now, when I use the word overdoses, that doesn't mean they all succumb to it, but we respond to overdoses on a weekly basis.